Hi everyone, welcome to the first episode of Humans for Care, Stories from Healthcare Leaders. We started this series really to talk to healthcare leaders about how AI supports care and sometimes quietly in the background so that humans can focus on what matters the most, which really is care. Today, we're honored to be joined by Ardi, CEO of Ang Mo Kio Thye Hua Kwan Hospital, who really brings a community hospital perspective to this conversation as well. Ardi himself has more than 20 years experience as a professional in the Singapore healthcare, elder care, disability, and the social service sector. He has accumulated extensive ground experiences and health strategy project in his leadership role. Now, with all the attention on AI in the healthcare industry today, we're especially interested in where AI generates value without disrupting care delivery. Ardi, thank you for joining us today.
Oh, thank you. Thank you so much for having me.
Great. Well, to really start the conversation going, right, to start broadly, where do you think AI generally adds value to healthcare today?
Yeah, I think for healthcare, broadly, within healthcare itself, it's very decision intensive. Whether it's the doctor, whether it's a nurse, and in our case, I think the rehab specialists who are here, even for the social workers, and those even in admin, we really have to make a lot of decisions on a daily basis. So I think AI really does help reduce some of the cognitive load that supports both safer as well as more consistent decisions. So I think the value, especially for us, and as we move into greater community care, really is in preventive and rehab care that can be delivered in a safe way, while making sure that the original workflows can be complemented by AI. So I suppose AI could be seen as the quiet infrastructure that helps us to do our work better and more consistently. So yeah, I mean, for us, we view AI in the entire healthcare landscape basically as an enabler of continuity, especially as patients go from the hospital to the home. So, so it's not just a tool in the acute settings, but also for us working closer in and within the community.
Right. Thanks for sharing. Yeah, and that's something I really agree with, right? With the advent of AI, this is like a wonder tool that we can really help to connect people, not just within the health clinical setting, but also at the home as well. But Adi, I've got to ask, right? Hospitals, community settings, healthcare, we have adopted many tools in the past, everything from the advent of computer software tools, many SaaS tools out there as well. How should healthcare leaders really think about AI differently from, say, other tools they've had adopted in the past, right? What are some things that they should really be taking care of?
I think peculiar to the healthcare setting, in the old days, there used to be decision support systems. So for a very long time, I think even it started in the 1970s, if I'm not wrong, everybody has been trying to key in, here are some of the causes that's making a patient not feel not so well, for example, and then to suggest a couple of potential things the doctor should look at. So the DSS, the decision support systems, I think have come a long way. And AI really, it is quite different. I suppose in the old days, the traditional systems, and that's just for the DSS, used to focus on automating a couple of tasks to help the doctor stay within certain parameters and to consider a couple of diagnoses and trying to cover all. But I think for AI, it does augment the thinking and coordination processes quite a fair bit more. I mean, we feel that AI should integrate data across systems, as well as to help surface timely insights at the various points of care. So AI is a reliable colleague. I mean, that's what I would like to call it. And as I mentioned earlier, it works quietly in the background and really should be aligned to patient outcomes. And for us,
Great.
those patient outcomes would be their journey towards better rehab, not just the potential, but to even surpass it.
I really like to what you say, a reliable, quiet colleague, right? That brings me to my kind of like a follow-up question, right? I speak to a lot of AI companies and a lot of healthcare leaders as well. A lot of times they bring out things like, what are the guardrails or principles, right? Do you think are necessary to kind of make sure that the colleague works intended, right? Make sure that the colleagues kind of like not go haywire, right? What do you think are some of these guiding principles that you think about when we're deploying an AI solution?
I think generally, AI is seen as something revolutionary and quite new. But I think at the end of the day, if you know technology, there's certain lessons that we can learn from automation, digitization, as well as just change management in terms of handling any new technology that's implemented in the workplace. Actually, what is really worrying, I think, for healthcare institutions would be the protection of the data. I think with the focus on LLMs, as well as even when we think about it, all of the information that is there, the database that we are also mining. So those things will have to be addressed, but really that is really in the background. But I think for people to accept the technology, it's the same change management principles. They want to see, they want to feel, they want to touch, and in some cases they want to taste what AI solutions really can bring about, especially if it's addressing a problem. Of course, now technology has also come a long way, and we are so used to certain types of technology being adopted, being part of daily life. So any change will have to be managed. So change management issues at the management level for the teams, for everybody who's involved. Yeah. So leadership has to really come through, and the standard guardrails will still apply for anything that is new.
Yeah. Great. I think absolutely right. Around change management, about getting people comfortable with the product, but making sure that the technical specificity around it, the guardrails about the data privacy, those are critical in the healthcare. That was really insightful. Thank you. I really want to move from a broader perspective to a little bit closer at home, right? To your organizations, right? I really love to understand how these ideas have been applied in practice and kind of how really has AI supported care at Ang Mo Kio Thye Hua Kwan, right, in a way that strengthens continuity of patients and caregivers without really adding to the noise and adding risk, right? I want to hear about some of the experiences that you might have. Yeah.
Okay, let me try to think of a couple of anecdotes or stories to share. But maybe I'll focus on the robots that we have. We have TAMI robots here at the community hospital. So I think making sure that such technology is utilized well is important. So for us, we really have to prepare the ground, make sure that there is standardized orientation that would also lead to freeing nurses' time, for example, in doing some of the more repeatable, I won't want to say mundane, but repeatable tasks, or tasks which that really automation, technology, and equipment can help with. But sometimes it also supports safety as well. So that is something that we can consider. So coming back to the TAMI robot, for example, I think gait monitoring as well as fall detection through the robot, as well as engagement with the robot and between the robot and the patients is important for us. But focusing on gait monitoring and falls management in hospitals and preventing incidents, such technology is able, at least we have seen, even though not much recorded research has been done in Singapore in terms of alerting staff early of these incidents. But I think that's something that research will address quite soon, and we would also like to embark on that. Working with Board MD, I think the project has so far been very good as we move from the different phases. But the initial feel and the use of WhatsApp-based touchpoints, I think it's helped to extend education and support as well to the patients and caregivers even after they are discharged from the hospital. And this is very important. I think a lot of our past patients as well as caregivers, when they try calling the hospital, if they get an automated call facility or a solution, they will just say, hey, I want to talk to a real person.
Yeah.
So I think this change as well within the community and the acceptance rate, the higher acceptance rate of the public in terms of how they interact and communicate with us through AI, or in this case, even using WhatsApp with an AI. I think, it's helped us.
Great. And from a leadership perspective, right? What processes do you kind of encourage your team to have when we are deploying this type of solution? Because you mentioned, right, patients today, they are a little bit they were a little bit averse to AI technologies, right? But when we start introducing technology, you mentioned about change management, right? If you would have one advice to fellow healthcare leaders like yourself, what would it be to share that what you have done or encouraged that enables such a successful rollout of AI solutions in your organization?
Well, Wei Chun, that's a big ask. I wouldn't. That's like asking an expert. So I feel really challenged to answer that. But okay, I mean, I'll just share our view basically on that. I think for AI and the current set of developments within the industry, really, I think AI is an evolution and not necessarily a disruption. And I think I have to go back really to what I said earlier, that it is like quite infrastructure, and it has to integrate with the processes we already have in place. Very often technology is seen as a little bit disruptive. I'm not talking about disruptive technology per se, but even for technology to help with a process, sometimes it changes the entire process completely. But for us, I think we are still very focused on reducing the manual burden, especially for the education of patients, and other very useful and important things as well, like follow-up reminders that really fit into natural workflows. So I think the only advice I have really to other leaders is to keep an open mind, to focus on the problem that they need to solve or to do it better. And I think all managers and management people are very focused on the rate of productivity, about making sure that there's also a ROI or return on investment on whatever they introduce, and they're very focused also on the time it's going to take from implementation to fruition. or even the maturity of that technology adoption. But ultimately, there's no fear of AI. I think, it should feel a lot more like having a well-trained assistant that also needs minimal coaching. And that's been our experience, at least with the solutions we have with you.
Right. I really like how you frame that a quiet assistant, right? That helps you on the background. And really, thank you so much, Ardi, for sharing your insights today. It's really valuable hearing your broader perspective of AI and really real life experiences at your hospital on how leaders should really think about having small incremental and but yet continuous changes on the approach to AI, managing change management, right? But more importantly, around things that you can really measure, right? Not AI for the sake of AI in that particular sense, right? Thank you for your time today. This concludes the first session of Humans for Care stories from healthcare leaders. We hope this conversation gives healthcare leaders a better understanding of how AI can really support patient care and staff workflows behind the scenes as well. If you really enjoyed this episode today, do follow our page so you don't kind of miss out on our future conversations. And feel free to join us in our discussion using the hashtag Humans for Care. Thanks, Ardi, and thank you everyone for your time.
Thank you for having me.